Climate change and health stakeholders are meeting to devise a common African position on climate change and health, which has never been included in the United Nations Framework Convention on Climate Change deliberations. Now, according to African health and climate change stakeholders, there is an urgent need to have health sector recognition and inclusion in the global climate change agenda. Africa is leading the globe in the push to have the health sector recognized in the UNFCCC climate change deliberations, citing the importance of healthy people in effectiveness of various sectors. In an inaugural high-level meeting in Lilongwe, Malawi, various climate change stakeholders and health organizations want UNFCCC to incorporate and have health slotted and defined as one of the key areas directly affected by climate change. The African continent becomes the first in the globe to have special deliberations and a push for health sector recognition by the United Nations Framework Convention on Climate Change.
We know very well that despite the fact that Africa contributes very little, there is no discount to the consequences. Whereas our contribution is less than 4%, there will be no discount of 96% to the consequences. The consequences will be severe as they will be elsewhere. And I think we've experienced this.
The goal of the overall PAGA strategy is to ensure environmental and climate justice serve a primary driver of sustainable growth and well-being for all people in Africa through mobilizing and empowering African civil society and the African people at large.
One of the critical things we need to work on as we talk about the climate health nexus is really what sort of evidence do we need to put on the table to not only say this is important from the perspective of, say, human rights or just climate, what you might call climate justice, but also from the investment case perspective.
Now, the tourism industry and education